West London, covered by the Shaping a Healthier Future, covers my borough as well. And there are a very small number of us here from that borough, which is Westminster. And the other one is Kensington and Chelsea.
Yeah.
I don't know how many of us are here. I have a mailing list of 64 people that I try to keep informed. I told them about this meeting. It is an extremely hard part of London to get people to pay any attention. They know that St Mary's Hospital is becoming overwhelmed because of the closure of other A&Es. But will they do anything? Do you know that there are people that I've campaigned amongst, when I've said to them, the NHS needs saving, they say, oh well, I don't actually care about the NHS because I have private insurance. And I say to them, if you and your children were knocked over by a bus or you were in a car accident, where do you think you would go? And they say, well, I'd go to a private hospital. Can you believe it that people pay health insurance to go private and they have no idea that they will end up with all of us waiting for 12 hours in A&E with all that riffraff. So that's, I think, an important message that we need to get across to people in my boroughs. But what I want to ask Stephen is, what efforts are you making to bring them on board, if any?
Right.
Because their constituents also need the wonderful report. They need to know about it. I'm doing my best, but I can only do a little bit. I sit on my patient participation group. I sit on my user panel. You cannot believe the level of complacency. It is appalling. I go to my PPG where my GPs tell me that they can't do all sorts of things because a whole lot of money is being taken away from them because they were a PMS.
What's a PMS?
A PMS is where they had extra things that they could do. So they had an ECG and they had phlebotomy. And that's now going to be taken away from them. In the name of what? Fairness and equality. Because those doctors were providing for their patients, and there are all these other patients who weren't getting this special treatment, so they're taking it away from everybody. So, sorry.